Welcome to Leading from the Heart, a specialty care series where we're highlighting the people behind the care. My name is Matt Gray, president of our cardiac service line, and I'll be meeting with associates across the country, hearing about their stories and their experiences. Today, I'm joined by Lukas Janson, clinical manager of our South Texas team right here in Houston. Lukas, welcome.
Yeah, thanks for having me. Happy to be here.
So, Lukas, what led you to your current role right here in Houston?
Yeah, so what brought me to Houston was went to the University of Arizona for undergrad and then perfusion school. Had some great presentations from specialty care actually while I was in school, and met some other perfusionists that worked for specialty care previously, and decided to look into it. And Houston was, to me, the most perfect choice. Came and interviewed and fell in love with the team, and about 2.5, 3 years in, I felt like management would be a good place for me, and I expressed my interest and talked to Dwight Crawford, my manager at the time, and I ended up actually applying to a position in Austin, Texas in our company for area clinical manager. Mm-hmm. And I didn't want to raise any alarms or anything, so I didn't tell Dwight about it, and then he found out, of course, and brought me in, and he just kind of said, look, if you're really serious about this, I'll show you the ropes, and if you still are interested, we'll definitely bookmark you for management, and here I am today. So,
awesome. Well, congrats. I know you've been in the role for a minute, but what's it like filling Dwight's shoes after he's been not only manager but also just been in perfusion for so long?
It's hard. I mean, the guy's been in it for 3 decades, and he's worn many hats. And honestly, I kind of feel like I filled two pairs of shoes, because I had Paul McKee before him, and then Dwight fell into the interim role for a little bit, and I learned so much from both of them. They're very different managers, and it's been hard. I mean, they have really set high expectations for the team as to what they expect from a leader and a manager, and I'm trying my best every day. It's not easy, but it's fulfilling, and I love it. So
yeah, I appreciate it. Well, it's fun. We can talk about, I thought you did a great job organizing this dinner tonight. So Dwight won't see this until after it's over. So great job organizing it. And I think that speaks a lot for your respect for him and the team's respect for him. So yeah, looking forward to it.
Yeah, me too. It's going to be fun. Months in the making.
Yeah. So when Dwight sees this, we can have a little fun laugh with him.
Yeah.
Because
gotcha.
Yeah, it's a good gotcha. That's right. So in your time as manager so far, is there any lesson that's jumped out that has formed and developed your thinking about being a leader going forward?
Yeah, I definitely. I mean, like I said, I was on the team for 3 years before, so being a peer with everybody and then moving into the management role, you do have to change your dynamic a lot. And I guess it's like that term, like stepping in it. Sometimes you talk and say things maybe you should wait to say. Nothing that necessarily is negative or bad, but things that might not make the team feel the cushiest at the time. It's change, they get maybe a little uncomfortable with change. And so just for me, I think waiting to provide the team information until I have all the information and I know how to present it well in a way that makes them feel confident and comfortable has been a big lesson for me, and something I'm always continuing to learn how to do the best, because I'm here for them. I'm here for the hospital to represent. And sometimes it's just finding that balance is, yeah.
No, I get that. And I believe one of the challenges that all clinical managers face is balancing patient first, people first. Everybody wants to be first, the hospital, the client. So how do you balance all those priorities?
It's hard. I always try to make my team know that they're very important to me. And I also do that for our hospitals too, and our patients are the most important thing at the end of the day. So they come first in my mind, and covering that. And but I do it honestly through communication, and I tell them and I tell our customers that I will always be there for you guys. I'm an open book, open communication, and it's all situational too, I think.
No, I get that. Well, what I've seen and heard is that you're really good at hiring and developing new grads. So has that become a passion of yours? And if so, what led to that?
Yeah, so I think we've gotten very lucky with all the new grads that have applied. And depending if they're a new grad or not, something that I feel very strongly about is when I interview somebody is being very transparent about our team and our team dynamic, because that is the core of who we are here in Houston with specialty care. And I tell them, look, like, you need to make sure that you're going to be happy here, because this is who we are. This is how we operate. And you're not going to show up being your best every day if you're not happy. And because the clinical stuff, especially as a new graduate, you can only learn so much in 2 years. So just being who they are as people is probably the most important thing for me when hiring somebody.
That's good. Well, we need new grads and we need experienced perfusionists, so the balance is ideal. So that's good. So if we switch gears a little bit and shift to the personal side, which is also important in what makes us. Two very interesting things about you that I think is, one, being a marathon runner. Would love to hear about that, how that's developed you as a person, building resilience, and then also how you balance that and with a new baby on the way. So there's some really exciting things going on the personal side.
Yeah. So I just ran my third marathon this last Valentine's Day, actually. My wife was happy about that. We had a good Valentine's Day, but I ran the Mesa Marathon. My goal is to go to the Boston Marathon, and you can apply at 2 hours and 55 minutes, and then depending on who applies, that time drops down even more. So we made the qualifying time this year, so we'll see. Hopefully I can get in, but running's taught me a lot. I do my best thinking when I'm running, that's for sure. Anytime I have a meeting or any type of strategic thing that I have going on that day, I really hope I can get a run in. It really sets the mood for the day. And with management, with running, especially marathon training, when you're trying to hit a specific goal, like a sub 2:55 marathon, planning and being proactive is one of the most important things. And I try to carry that into management as well. If I can stay steps ahead, then it's best for my team, it's best for my accounts, it's best for our patients. And with resilience, I mean, when you're running 60 plus miles a week, you're going to have some bad days. You're going to feel hurt. You're going to feel tired. And it's just like laying those bricks, brick by brick, to get to the final goal is so important. So getting back on the horse and keeping on with it has taught me a lot. Yeah.
Well, having a new addition to the family is going to reset priorities a little bit.
It's our first baby, so that's when time management's going to come into effect too. And being an area clinical manager, we are still very clinical. It's not just administrative stuff. So one of the most common surgical procedures we do is a coronary artery bypass grafting. And in the beginning, they bring the patient in and put him to sleep, and surgical assistants start taking vein in the leg. The surgeon will open up and start taking the mammary down. So that gives me the 45 minutes maybe to get some work done on my computer, or just to find those little slots of time. And I'm sure when the baby's here, it's going to be even more important to do that, to be there for our people. So.
Well, one thing I do in these interviews is I like to turn the table and let you ask a question of me. And unrehearsed, and catch me totally by surprise. So.
I didn't expect this, I guess. So I guess I was thinking, like, you're not from a medical background originally, right? So kind of like, what brought you to specialty care and what makes you love your job?
Well, I'm not clinical, but my background's been all healthcare. So you could look at my career in 3 different phases, starting with the payer side in healthcare. So I got to work with nurses and doctors, but on the insurance side of healthcare. Then my second phase in my career was with CVS Health, and so worked with pharmacists and in a very high volume prescription medication dispensing piece of CVS, not the brick and mortar retail. Then I stepped into the full continuum of care with Team Health. I saw the emergency room, inpatient setting, and post-acute setting. So I got to see patients go through that whole continuum. And then, of course, now with specialty care, by far the most specialized segment of medicine. So I've not been like yourself and treated a patient, no hands on the patient, for me per se, but supporting great clinicians my entire career. So
has it been hard? Like going to a very concentrated cardiac type of business, was that a hard learning curve for you?
It was a big learning curve. Wasn't hard. It was exciting. So each of the those phases I mentioned, I had to learn. It was a big learning curve. But I would say moving to specialty care, even after being several decades into healthcare, it was by far the biggest learning curve because we're just so specialized.
Yeah.
So yeah, it was fun, but it took a minute. But it's not hard when you're enjoying it. It's just takes time. So.
Yeah, and I think that manager's meeting we just had was so beneficial, and it made us all feel like a family. And even though we are specialized and far away, it was nice to see everybody.
So Lucas, thanks for your time. Appreciate you stopping in. This is not what a perfusionist and a perfusionist manager probably signed up for, but I think it's important that everybody hears stories of both you and your peers. So thanks for spending time with me. And for everybody tuning in, thanks for joining for another episode of Leading from the Heart.